Do you need contraception during sex during pregnancy? When pregnant, there is no need to use contraception to prevent pregnancy. Because a woman who has been pregnant cannot get pregnant again at the same time in most cases. However, there are still some things to keep in mind. White heavy checkmark. When is it not necessary to use contraception during sex during pregnancy? Normal pregnancy, no complications. Both husband and wife are healthy and do not have sexually transmitted diseases, STDs. Sex is gentle, not rough. Warning sign # when should you consider using protection, like condoms? When one of the two people is at risk of or has a sexually transmitted disease, HIV, syphilis, gonorrhea, etc. When your doctor recommends limiting cervical stimulation or avoiding vaginal infections. When the pregnant woman has a history of miscarriage, premature birth, weak cervix. Black question mark ornament. Some people worry, is it possible to have twins at different times, superfertilization? The phenomenon of superfertilization, that is, being able to conceive again while already pregnant, is extremely rare, almost never occurring in humans. So contraception is not needed to prevent another pregnancy. White right pointing backhand index conclusion. Contraception is not needed to prevent pregnancy once you are pregnant. Condoms may be needed for disease prevention, or as medically indicated. Consult your doctor if you have a special pregnancy condition. Couple with heart-safe sex positions during pregnancy. The position should prioritize comfort, gentleness and avoid putting pressure on the pregnant woman's abdomen, especially from the second trimester onwards, after week 13. 1. Spooning position. Both lie on their sides, the husband behind. Less pressure on the abdomen, very safe and gentle. Suitable for all stages of pregnancy. 2. Woman on top. Pregnant woman sits on top, controlling speed and depth. Avoid pressure on the abdomen. Pay attention to balance so as not to lose balance. 3. Edge of the bed position. The wife lies near the edge of the bed, the husband stands or kneels in front. Helps reduce pressure on the abdomen. Convenient for the third trimester. 4. Doggy style, gentle variation. The wife knelt on her hands and knees, the husband behind. However, be careful and adjust the depth. Avoiding being too forceful. No entry signs you need to stop having sex immediately. If you experience the following symptoms while having sex, stop immediately and see a doctor. Large red circle, vaginal bleeding, even just a little. Face with bandaged head, lower abdominal pain, abnormal uterine contractions. Droplet amniotic fluid leakage, or vaginal discharge. Persevering face pain during sex, not comfortable. Hourglass with flowing sand, feeling of heaviness in the lower abdomen, falling abdomen, a sign of threatened premature labor. Warning sign # when should you completely avoid sex during pregnancy? Your doctor may advise abstinence if weak cervix, risk of premature birth, low-lying placenta, placenta previa, early amniotic fluid leakage, twin or multiple pregnancy is high risk, history of miscarriage, premature birth many times, vaginal or cervical infection. White heavy checkmark, general advice. Open communication between husband and wife is very important. Always listen to the mother's body. Consult your doctor if you have any concerns. Have a nice day. Bye.